Here we are at Sonic Family Chiropractic. We're going to adjust somebody that's 39 weeks and 2 days pregnant. Big belly, that's why we have extra pillows. She's still going to start by lying face down, so we're going to go through the entire adjustment with her. You ready?
Yes. Good evening.
Face down. The most important part that I feel in a pregnant pregnant woman, right down here at the pelvis. This is where the baby sits, right down in the pelvic bowl. This entire structure right here is the one that gets out of alignment the most. Out of alignment, it can cause things like sciatica, pain running down the legs, in the back, around the butt. It can also cause a lot of low back pain in this area if the pelvis is not aligned correctly. Especially as the woman grows, she's going to face a lot more weight down here in the pelvis. This instrument is called an impulse instrument, and it's just light pressure that's placed right on the spine. There's no electricity coming out of this instrument. Right?
I could pretend.
Okay, we don't pretend. When women are pregnant, all the organs get moved upward into the rib cage, and the rib cage becomes very tight. So it's important to do chiropractic in this area. Correct? Mm-hmm. Right, now we'll block the camera. So push up to your knees, like you're doing the cat-cow pose, all the way up. Come on, all the way up. And towards the end of pregnancy, it's certainly harder to move around on the table. Left side. When doing this type of motion with a pregnant woman, it is very important to keep the spine straight, to not over-torque the spine. As the ligaments loosen closer to delivery, the adjustment itself should be really easy to perform.
Like that?
Yeah, it's real simple. On your back. This adjustment right here also helps with the mid-back once again. A little bit. You okay?
We're both sick. So we have 1, 2, 3,
Little
4,
adjustment right up here.
4 people that are sick.
I come from bed, it's been my good. There.
Last thing that I do with each pregnant woman is hold pressure on the round ligaments. These are ligaments that also attach to the uterus, and it's a very, very light touch. You had any contractions yet?
Nothing worth talking about.
So at 39 weeks, 2 days, no contractions quite yet. But I think you've had your other kids earlier. Earlier?
Mm-hmm.
Earlier,
Last two
right.
were earlier.
Last 2 were earlier than 40.
Earlier than 38. No. Yeah.
Tenure down here at the pubic bone.
Dr. Sonak,
Yes,
can I give this to my brother?
you can. Even right now, there's not a whole lot of swelling that she has. A lot of women will swell in the ankles towards the end of pregnancy.
Get me at the end of the day, I need to see it.
End of day is worse. I got it earlier on in the day. So Rachel happened to be in a car accident halfway through her pregnancy. Especially if somebody's in a car accident, it is really utmost important to get chiropractic care throughout pregnancy. You ready? Come on up.
Ta-da!
And that's it. Pregnancy at 39 weeks.